Hi there. Welcome to Jay's Durham Animal Hospital, where all of our committed professionals have pets at home, so we know exactly how important your pet is to you. A story we'd like to share with you today is of a patient we admitted last week with Grade IV Hip Dysplasia, who just underwent surgery. Hip dysplasia occurs when the femur bone's ball is partially or completely out of the acetabulum, also called the hip socket, that is used to diagnose the condition. The patient that we're going to discuss today is a border collie named Drogon. He is a 10-year-old neutered male weighing at 45 pounds. He was brought in by his owner, Daenerys Targaryen, because she noticed some limping in his right hind leg and some whimpering when it was being touched or moved by her. Daenerys has also claimed that although Drogon has been slowing down due to his age, he was not as energetic or as playful as he usually was. She also noticed that he wasn't eating or drinking as much either. Due to the soap form we received from the surgery ward, there were a few guesses that he might have sprained his leg, or that there was some possible arthritis involved. Immediately, an estimate was made up for Miss Targaryen, so that she was fully aware for about how much the procedure for Drogon would come to. After some radiography imaging, it was determined that Drogon had Grade IV hip dysplasia. He immediately underwent a femoral head osteotomy due to his age and the level of hip dysplasia. A femoral head osteotomy is the surgical removal of the head and neck of the femur bone. Later on, Drogon was moved to our area of the clinic for post-surgery monitoring. He remained there under our care for the past 2 days as he was healing. To keep record of Drogon's well-being for that amount of time, 2 treatment sheets were filled out on his behalf, one for each day. The treatment sheets both included important points like his attitude, temperature, pulse, capillary refill time, respiration, lung sounds, etc. We made sure to check for all of these things and fill out the points on the sheets every 3 hours. The treatment sheet also included that we administered 30.1 milliliters of plasma-like fluids every hour, plus meloxicam to treat pain and inflammation. Both of these were administered through IV every 24 hours. Once Drogon was able to be released from our clinic, we made sure to give Miss Targaryen an invoice that included prices for a complete blood count, profile, hospitalization, surgical IV fluid therapy, anesthetic, isoflurane inhalant, monitoring, radiology setup, radiographs, meloxicam, and a surgical pack fee, along with some post-operative instructions for Drogon's home care. Drogon was also sent home with an e-collar to prevent any licking or biting to the surgical wound. Finally, we gave some additional Medicam to Miss Targaryen to give to Drogon in liquid form, about 0.2 milligrams worth orally every 24 hours, as he spends the rest of his recovery time at home. Over the next 2 to 3 days, we will be keeping in touch with Miss Targaryen regarding the well-being of Drogon. Meanwhile, everyone here at the clinic wishes Drogon all the best with the remaining of his recovery.